Hello, everyone, and welcome to the Immersive Medical Podcast Season 2. We have a very special guest for you today, Dr. GPT himself, Harvey Castro. Connor, who's Harvey?
Harvey is a LinkedIn top voice, a GPT advisor, physician, expert on AI in healthcare, former health system CEO, and author.
And physician, he's an emergency doctor. We had a phenomenal conversation with this guy, and we're really excited to bring him to you guys. One of my favorite things that we talked about were when we asked him what I thought were tough questions, and he just had some quick answers for, like, what's coming in AI and healthcare that we don't know about. And his responses were well thought out.
Oh yeah, he had a lot of insight on that and the positives and the negatives of using AI in healthcare, GPT as an assistant.
Yeah, right. All kinds of stuff. It's pretty amazing how he, as a physician, is using AI to help public health and our healthcare. So we are very pleased to bring you Dr. GPT. Harvey, welcome to the Immersive Medical Podcast, or should I say Dr. GPT. Welcome to the IM Pod.
Thanks for having me, guys. I appreciate it.
So I got to ask you right up front, where did Dr. GPT come from? That's pretty cool. I like it.
So I have to go way back. So when when ChatGPT came out in 2022, I literally must have stumbled across it on the day one. And I started playing with it and I thought, holy cow, this is going to change medicine. I got so excited. I went and told my wife, I was like, man, I'm going to write a book. And she's like, you just saw this. And I'm like, yeah, but this is going to change medicine. And fast forward, I know she thought I was crazy because during the holidays, I was just typing away. I was just determined to do this book. And as I'm telling my friends about it, they were like, chat what? GPT what? Like they just wouldn't get it. And then my friends started calling me GPT Doc or Doc GPT. And then they started, just kind of making fun of it. But now it's so funny because those guys that were joking with me back then, now they're like, dude, that's so smart. Like that. I wish I had seen that coming.
Yeah. So that's what genius is, right? Genius is ahead of its time. It appears to be crazy in the moment, but you weren't crazy. Everyone else was crazy.
So Harvey likes to hit the ground running here.
That's right.
I gotta throw this other one since I heard you love ER. I gotta tell you this ER story real quick.
Let's do it.
It's related. So I'm gonna date myself. Back when the first iPhone came out, I'm playing with it. I'm like, oh, this is a cool phone, and I'm coding a patient in the emergency room. And I told the nurse, hey, we need to start this drip. And the nurse is like, 1 second, doc. She goes, gets a textbook, starts thumbing through it. She's like, yeah, okay. Gets a calculator. She's like, yeah, that's about right. Okay, let's start. And I'm looking at her like, oh my God, no. Like, we need to do something like yesterday. That took too long. And I literally taught myself how to do an iPhone app, created the first IV app in the world. It went viral. And it was just 3 touches and it would take you right to the drug, and it was so exciting. So
wait, how did it work? 3 touches. How did that work?
So you would open the app, and then you would find the drug, and then you would hit the dose, and then it would show you, like you would say, open the app, and then it would say list of drugs, and you just tap on the drug because it was all the common drugs in the ER.
Sure.
And then you after you hit the drug, then you like just some mail, and then I had it like hyperlinks, and so
Sure.
It'd be like 70, 80 kilos, and then you just click, and then boom, there's your drip.
Your drip rate.
Yeah.
Wow. So for those listeners who may not be that medically inclined, or maybe you don't count drips, but you still work in medicine, when you're doing weight-based drugs, you have to count more than just the milligram. There's a concentration, then there's the milligram dosage, and then there's how fast is that going into the patient and for how long. And it's kind of a tough mathematical equation, so extreme value, especially in an emergency.
Yeah.
Not only did you have to figure out what all that calculation was, but you also have to code it for this brand new device that only, it was selling off shelves. It was flying off shelves, but you had to code for a device that, no one really knew how to work yet.
Yeah.
That's crazy.
Yeah, I'm really passionate when it comes to a pain point. If it bothers me, if it's something that obviously I'm a doctor, I'm passionate about healthcare. then I just feel like I got the responsibility to jump right in and do it. Like, I'm not going to wait for someone to create or do or complain to my boss. I'm going to try my best to create it and fix it myself.
Well, let's jump right into AI and healthcare then. Let's dive in. Because I think that you are on the cusp of something that has the potential to create immediate impact. Some people are scared of it. I do think that there is some potential dangers, right? I think we're all aware of them, and we want to keep our finger on the pulse of AI and make sure we give it the appropriate bumpers in the bowling lane, especially when it comes to people's lives. However, on the IM pod, we talk about it all the time. There is a staffing shortage, huge in frontline healthcare. And so you've got the World Health Organization saying 15 million shortage by 2030. That's in 6 years. I mean, last year we were saying it was in 7 years. It's getting closer every year.
Yeah.
And people are aging out. So knowing that there's problems, plentiful problems in healthcare, and now these very, very fast-moving solution products, these machines, these in the cloud AI things that people can't see or touch, but they're solving problems, and they're combing through data faster than any human can and producing results for people quickly. What do you see as maybe some of the low-hanging fruit with AI and healthcare for improving our world today?
Yeah, that's a tough question, and I love that question. The way I see it, and we can go into the negatives, but some low hanging fruit. You're gonna laugh when I say this, but it's all about communication. Down to when you argue with your spouse, when you don't like what your boss says, or you're the boss. I think it boils down to communication. And the reason I start with just saying communication is I feel like ChatGPT and a lot of these GPTs can do an excellent job communicating. And how is that related to healthcare? Well, if you think about it, I'm communicating medical knowledge to you as a patient. And if I do not communicate well, i.e., maybe I don't translate the medical jargon well enough to a patient, then the patient's not going to get the best outcome just because of that communication. And so some simple, low-hanging fruit is, give you a case point. I used to work literally down the street from the airport, and anyone that got sick and on an airplane that was flying into DFW, I would be the doctor that would see you, because they would literally take you off the plane and drive you straight to me, to our emergency room. But imagine in a world where I may not speak that person's language, and the translation service may not have it, because again, it's literally languages from all over the world, maybe really a really rare one, but now I can use ChatGPT to do that. But then take it to the next level. If I'm in Dallas, Texas, and you're in Ohio, and I'm giving you some football examples, you probably don't want to hear the Dallas team. You probably want to hear some local team, some local culture examples. You probably want me to relate more to your sex and your age, as opposed to me just giving you a blanket statement. And so again, I can use ChatGPT to help me use the right words, the right examples to really communicate, because the better I communicate, the better healthcare outcome you will have. If I'm a horrible doctor, you don't want to see me, guess what? You're not going to come see me. If I try to explain something to you and I just don't communicate it really well, then you may not take your meds. You may not come do a lot of the things because I'm not doing a good job. But if I use ChatGPT, what an amazing opportunity. And let me give you a really cool example.
Okay.
Say I'm talking to children, and say I'm diagnosing a pediatric 5-year-old, and I use this example a lot. If I tell them, hey, here's your asthma, and here's your medication, and here's your discharge papers, the 5-year-old look at me like, I don't know what he said, and I'm off to do something else. But if I change my approach, if I take the current standard discharge instructions, feed it into ChatGPT and say, change the words of how you would talk to a 5-year-old. Give me the words of a 5-year-old. And then I stop pretending to be doctor, and now I talk like a kid. And I give that to the child, but then this is the best part. If I take those principles, say taking your meds, tell an adult if you're having an asthma attack, simple stuff, or if you're exercise-induced asthma, every time you run, you're going to get asthma. Mm-hmm. What if I take those core concepts that are in the discharge instruction and now feed it into ChatGPT has this, where it can create a coloring book based on those concepts. And so now when I discharge that kid, I'm speaking their language, the right words. I am coloring with the kid or the nurses or the parents. And now the child can say, holy cow, yeah, I should take my meds. Oh, I see this is the way I should wear my mask. And they may not realize it, but they're learning. And guess
They're
what?
learning,
More
and
than
it's
likely,
improving their health.
exactly. And they're not going to come back, which is, I'm fine with them coming back, but they're ideally, you want them healthy and safe and they're preventative and they're taking their meds and they're really getting it. And so now I'm communicating to a child that maybe I would have never done. And you know what? Parents, as much as busy as they are, they may not even read those discharge instructions. So whatever those
Wow.
13 minutes that it's a national average with the patient, that is as much education as they get. And that's all the communication. So again, boom, ChatGPT, I'm helping them. I'm really taking it to the next level. And then let's talk about the younger generations. I'm an old doc. I've been ER for 20 years, but some people don't want me to, like my kid. I can't give him a large explanation of anything. It's got to be to the point. It's like that quick. So what
Short,
if I,
sweet,
again,
minute or
took
less.
ChatGPT,
Yeah,
created
TLDR.
summaries. Yeah, exactly. And I create the summaries, but then instead I use a convert. I have my voice cloned, by the way, and I have my own podcast that I clone my voice, and we could talk about that one. But I put my clone voice in the discharge instructions, and now when the patient's driving, they can listen to my discharge instruction. They can
Yeah.
understand. They can repeat it. And then let's just talk what OpenAI just did with the video. Now,
Yeah,
in theory,
They just
Sora,
launched Sora.
in the near future, it only gives me so long and I don't have access. But let's just say I had enough for a 5-minute video, then man, I could customize your discharge instructions. And now when you go home, it's a video of the
And
discharge.
it could be you.
Exactly.
You
How
know, I think right
cool.
now they're working on Sora. They're only doing a limited release because they got to give it parameters and they want it to remember. They want ChatGPT in general to remember, right? So that changes the game because if you create a scene, you want to create a second scene or a second video or a second photo even that is like page 2 or slide 2 or the second frame of your story that you're telling, it's going to recreate something fresh on the second one. And they're not going to match. It's not going to be the same character or it's not going to be
Yeah.
the same you. But once they solve that, and with Sora, and suddenly there's a photorealistic version of you telling a story over multiple minutes, broken up in chunks, but it's still you. Yeah, that's powerful.
Yeah. And
It's
then
also scary. There's a
it
security
is
issue there.
scary.
Yeah.
It is. But then let's keep going. Let's pretend now we got the Apple Vision Pro. Nothing takes this away from me putting this on my patient and saying, hey, let's look at your heart. These are your actual images of your heart. Let's look
Right.
at it in 3D.
You're going
And
to
this is
upload a
why
CT
I
scan
want,
or an MR.
yeah.
MRI. Yeah.
And then this is why I'm so passionate about you taking your medicine. This is why I don't think it's a good idea that you skip. Let's see the damage. And then again, it goes back to simple communication. And then when they see it, they're like, oh my God, I didn't realize that's what's going on. Or some smoker's lungs, showing them pictures in 3D and it's like literally in their face. I mean, I know you could project it on a computer screen, but that effect of immersion to be really in your body and to see it, it just takes you to another level. And I really think if patients see that kind of stuff, they're like, oh, you know what? Yeah, I need to start taking my meds.
Yeah, it'll have a
Right.
bigger impact if you can reach out and quote unquote touch it and interact with it that way.
Yeah. And these are all real examples. I mean, Epic is an electronic medical record. They're already using this in healthcare.
Are they doing it through MyChart?
I forget. I downloaded the app yesterday, and I forget the name because I don't have access to it. But I think it is. I think you're right.
Yeah.
I think I did see that, which is amazing
you-
because you can just jump in and be in your electronic medical record with your VR on.
That's crazy. Have you used K-Health yet?
Not yet.
That one I think you should look into. It's pretty cool. K-Health is very similar. They used a large language model, de-identified about 2 million patient records, and it does this diagnosis, and then you can actually get your orders fulfilled. You can get your prescription all through an AI chat. So it's reducing the number of people going into the emergency department because they actually don't need to go in for their prescription refill. And they are getting an actual differential diagnosis based on 2 million people with a similar, or at least a percentage of the 2 million with a similar chief complaint. Really fascinating. They were featured on a podcast called What's Your Problem? I highly recommend that one. It's a good one.
I will listen to it. I will do
All
it.
right, let's bring it back down to earth a little bit now, guys. We're getting a little
All right,
too
thanks.
heady and in the weeds.
What you got, Connor?
Harvey, we've talked a lot about, using ChatGPT and AI in healthcare and how we're using it now and how you saw it in the beginning, how you saw it going in the future. Now it's one of the fastest moving industries in the world ever, basically. Where do you see it going in the next 4 or 5 years?
Yeah, that's another hard one because I see so many things in the future that are here now. Yeah, but you're right. To hit your point, we've had ChatGPT 1, 2, 3.5, and now 4. So it's been out there for a while. It's just and this is the best part for people that don't know this. Google actually invented this technology. It's just that OpenAI is the one who launched it first and let us play with it first before anybody else. So, but to answer your question, the things that I'm seeing now and in development, and that I see this becoming commonplace in the hospital system is pretty simple stuff in the sense that there's a lot of pain points in the hospital. One of them is think of transfer of care. If I'm doctor, for the day and then I leave and then it's the second doctor that comes on, that communication, again, goes back to communication. Things can get disrupted. If I don't say something or if I forget or if I didn't put it in the electronic medical record, it doesn't transfer. And so simple stuff right now that OpenAI and a lot of companies are working with the electronic medical records and in healthcare is creating summaries, creating things so that I can transfer this to the next doctor. So he and she can look at it and say, oh, this is here. Because think about it. If I'm taking over the emergency room and there's 20 people in there, imagine keeping all that straight and then forgetting to tell the next doctor, oh wait, I forgot, I should tell you this, this, and this. It's just a lot. But if you have this AI model that's able to summarize and give you the key things that must be communicated, that's amazing. The other part to this is there's patients that will show up and say, oh yeah, they won't talk to me. They'll say, look at my medical record. I'm like, no, can you tell me, a little bit about your past? She's like, no, it's in the medical record. Just go through it. And then I'll go through it and I'm looking and I'm like, oh my God, there's 20 years of medical record here. And I'm having to go through all of it and trying to figure out.
Help.
Yes, exactly. And so now AI can go through and say, okay, here's the working diagnosis. These are the things that we're working on. This is this is the continual problem. And I know you can cheat and go to the electronic medical record and look at the end, but there's just so much more in there. Like what was their last CAT scan and what's the trends,
And the end doesn't show you necessarily context, right?
Exactly.
Like you might be able to get the end result in there, but like you kind of need the story. You need to know how they got to that result and why. All right, before we go any further, I want to give a shout out to our friends at VR Patients. VR Patients is bringing the future of scalable clinical education to you with the world's first virtual reality simulation authoring tool. What the heck is that? It basically means educators can author patient scenarios and medical illnesses in VR, no coding required. These guys have turned medical training into a fully immersive experience. Whether you have 10 students or 10,000, VR Patients allows you to tailor the experience to your exact needs. Head on over to vrpatients.com, that's vrpatients.com, and get the lowdown on this game-changing platform. And if you have a VR headset at home, you can try it right now for free on the MetaQuest or Steam store. Hey, Harvey, I'm a techie, right? I'm going to geek out with you a little bit. I know Connor's got an Apple Vision Pro behind him. I know you're all on the Apple Vision Pro. I don't have one yet. However, I'm going to show you this fun little gadget that I just picked up. I wasn't going to show this, but if you're not listening, you should check it out on the YouTube channel. So I just picked up Plod. Have you heard of Plod?
No.
So this is Plod, and it just magnets to the back of my phone, and this is it right here, right? It's this little thing. So this little guy is an AI ChatGPT-enabled voice recorder, and so what happens is when I'll this just happened to me recently, so I took like a phone meeting with my boss, and we were talking about some really high-level stuff, and often I find myself distracted because I am feverishly writing notes about all these really important intellectual things and problems we're trying to solve, and it kind of distracts from my core focus on listening and collaborating with him in the conversation, because I'm also trying to capture it at the same time. And this little thing, after the call, I go into the app and it gives me a summary with action items and a mind map of what we just discussed. And
I like it.
It takes a minute. And it suddenly just kind of like relieves me from needing to try to remember every single detail and jot everything down. I can just focus on the creative moment, the creative problem solve, and trust that I'm going to have some notes. It reminds me of having like Otter AI in your Zoom, meetings, and okay, good. This is being transcribed. I've got a note taker. That's very helpful. And now I can do that anywhere in my life. I did it the other night when I went out to my kids' school to get introed at this new school for my preschooler. And, I had to talk to the principal, and I had to talk to like all these faculty members. They're telling me all these new things about this new school. I just texted my wife all of the bullet points and action items from parent-teacher night. It was incredible.
I love it. Love it.
All right,
And I'm going to show you, since you're geeking out, and
Let's geek out
on YouTube, I'm going to show you my other toy, and it's the Meta Ray-Ban glasses.
You've got the Metas? Oh, man, I was looking at Frame. All right, why Ray-Ban over Frame? What you got?
Okay, just because I do a lot of talks, and I bought these back in November, and I knew that in the future I would be able to take a picture and analyze the picture. And I'm an early beta tester now, and I got them. These are transition lens, so they don't look so geeky. They look kind of cool outside, and they also protect the blue lights. But what I like about this is just the principle again. I can, in theory, again, this is not there yet, but in theory, I could be able to take a picture of an X-ray and it would analyze it and say, okay, that's pneumonia, or there's this kind of disease, or this dermatological issue. I think it wouldn't be hard to do. And to your point, why these? It's probably because it was the first to market, or in my opinion, and that's
it's
why.
Backed by a big daddy, daddy Meta.
Yeah. But I did order the other ones you just mentioned because they're open source, and my business partner and I are going to start geeking out and make some apps for it.
Oh, please let me know how Frame goes. Yeah, I knew we were going to become friends, Harvey. All right, let's keep this going. We got off track a little bit with talking about fun technology. So if you guys, again, if you're not on the YouTube channel, hop on over and take a look at all this fun stuff, and we can put links in the show notes as well. Mm-hmm. So I want to bring this back around a little bit to all of the professional healthcare workers that are listening to this pod. A lot of them are clinical educators. They are simulationists. They are on the front line of improvement processes and quality at the hospitals. And that is both initial training and education, and then also remedial training and education. So like there's a Sentinel event at the hospital and you got to do some remedial training, or you are a college. You only have so many seats in your school and there's a shortage, and you have a line of people waiting to get into your nursing school. How do you produce more nurses or more fill-in-the-blank healthcare worker that are equally, if not more competent? We cannot go backwards. You cannot produce, typically you produce 50 nursing students a year, and you can bump that up to 75, but they are half as good. That's not a solution, because people get hurt in healthcare when people make mistakes. Medication errors need to go down, right? Burnout and recidivism needs to go down. So how do we improve healthcare when there's that public health crisis? And so this is the question. Let me round this up. The question I wanted to ask you is, how can AI in healthcare improve a staffing shortage? Do you have any inside knowledge for us? Are you on the front line of some stuff that we don't know about yet?
That's funny. I actually wrote a blog about a year ago about this concept, and I came up with this idea, and it's probably not me, but I just thought of it through, and here's the skinny. AI can help us, and let me preface by saying it may not be ChatGPT. We need the AI that has been trained on the data by healthcare, has been reinforced not by non-healthcare, but by doctors and professionals in the correct field. So I'm an ER doctor, so I should only stay in my box. I should only reinforce ER. If somebody's got a cool large language model and it's on surgery and they're like, hey, Harvey, come tell me if this is good, I have no business in that because I'm not a surgeon. So assuming we use the correct one, then now this can be a tool to help students. And I know some doctors hate it when I say, I really think if I had AI right now, I could get through med school in 3 years and be just as good, if not better than 4 years. because the amount of information, to me, it's all pattern recognition. It's all seeing problems. If diabetes shows up 20 different ways, if AI could show me all 20 ways and I can understand all the different flavors, I'm like, oh, wow, I get it. As opposed to going to the hospital. And I still think, obviously, I would never say don't go to the hospital as a medical student. I would still, but being in the medical student, being in the emergency room, and literally waiting for all the different presentations. I may go through a whole lifetime and never see some of these presentations. And so having AI to educate me now, guess what? If I can get through quicker and get as well in the knowledge, then in theory, there could be more doctors. Now, when I blogged about this, I know some people were really upset about when I said this, but I said we need to create a different class of healthcare professional. We got our doctors, we got our PAs, we got our nurses, we got our medical assistant. Let's create an AI medical, whatever you want to call it. So that way they are proficient on the AI. They know the good, the bad, of the ugly. They know when it's being lied to them. And then they have the basic knowledge. And obviously they're not going to replace a doctor or a nurse, but give it enough information so that these individuals can go into the workforce and help. Because there's two things going on. We're getting people retiring soon because they're burnt out.
Yeah.
And then the workload is so much that if we could pay for another workforce to come in, maybe we don't pay them as much, but if they can do more, then now I have an assistant. And this, you're going to go crazy on this one. The next one is, I think, and I know I get a lot of slack when I say this, I think the next step that we're really close, because ChatGPT has invested in this as well, is we're going to have robots. And I really believe that it's going to be our solution in healthcare. And let me just walk you through it. If we have a robot and the eyes of the robot is ChatGPT 4 or call it ChatGPT 5, and I'm sitting next to my robot and say Devin comes in, I can ask my robot, hey, give me Devin's blood pressure. Just looking at you. Listening to your voice, it could tell me your blood glucose. Listening to just looking at you and your tone can tell me about if you have early Alzheimer's, Parkinson's, just standing next to me.
Do you need a psych consult for depression?
Yeah. Exactly, like everything. And then let's say I'm old and my back is really bad, and say you fall and I need to help you get up, but I have a really bad back. I have the robot to say, hey, can you help me lift Devin up here? Because I can't physically do it.
You know, I want to loop this into, let's go even deeper down this rabbit hole. So a known deficit in medical education is nutrition. And it is the thing that we all put into our bodies more than anything else. You eat more than you take any medicine, more than you do anything. People eat more than they exercise and don't exercise. That's what we do. We stuff our faces. And to think that that's not changing our chemical balance in our body and that's not directly impacting your cardiology, your medical conditions, your nephrology, well, that's just crazy talk. But nutrition is not a huge piece of the medical training puzzle, unless you're going to specialize. That's just one piece, right? So, however, with AI, does the doctor need to know all the nutritional carb counting stuff and all the pieces, or can the AI know that? So that way the doctor can move the puzzle pieces, have more puzzle pieces to work with. Now, what does that do to medical education? Let's loop this into like anatomy, right? How much time as a physician or as a student did you spend memorizing every single ligament and piece of the body? And then how much of that did you actually need to address? So you could just typically go off of like your typical trauma very likely is not happening to certain parts of the body, you know, just not frequently. Most of your traumas are going to be like heads, arms, legs, like the limbs that are flailing around. And there are other muscles that you're just like, I have not read or looked at that muscle in 10 years.
Yeah.
Is it really incumbent upon the physician to know all of the muscles, or is it incumbent upon the physician to know what to do with the treatment to connect the dot contextually to treat the patient and allow the AI to hold on to that data load for the physician? I get excited about stuff like that. Like, what if you could turn to that robot and have that conversation with them, and that robot can connect the history, the context of their diet, knows all about the anatomy and everything that they're going, has their scans, so knows any missing anatomy, and you can have a conversation and you could say, it seems like they're having an issue with this part of their body. What are the 5, main areas and the small details on there? What about lymph nodes? Oh, that lymph node. That's right. Right now, I'm the expert, and I'm going to let that be the data trove, so I can treat and spend more face-to-face time with my patient. In a world like that, do you see medical education changing? I mean, they would have to adopt change, but is that a positive change, or is that like a scary pushback change? Like, why would our doctors need to memorize the Gray's Anatomy book?
Yeah, I'm thinking that's a good one. I love it, dude. Good question. So on the anatomy portion, as an ER doctor, if someone had really bad lacerations in their hands and they were all cut up, it helps to understand the anatomy of the hand and the ligaments
Oh,
and
absolutely.
whatnot. But I agree with you. There's some parts that I'm not a surgeon, so I'll use that example. Like, do I really need to know exactly what the appendix looks like in a bad looking appendix and find it and cut it open and all that? No, I don't. And do I need that knowledge for it? No, I can get away with just knowing the symptoms, how to treat it, what to find, all the different telltale signs, and that makes me an amazing ER doctor. To your point of moving forward, we're talking about the same thing. I feel like medical education needs to change, and to some degree, we need to know the basics. For example, I did pre-med, and there's all the stuff that I had to memorize, like organic chemistry and all these crazy stuff. And do I ever use it today? No. I would have
No. I
wished
mean,
I
you
could
need
have
the
gone into med
understanding.
school. Yeah.
I'm
Yeah.
not no hey, and I'm not pushing against about like give them the core knowledge, the core understanding, but driving on it for 3 years on OChem
Yeah.
is probably, I think that time could be filled maybe
Yeah.
with more contextual education on patient care and face-to-face time and bedside manner and all the
Yeah.
other deficits we're aware of.
Yeah. So you said a couple of things I gotta blurt out there. Number one,
Yeah.
If say I had a diabetic patient and I need to educate them and I don't know nutrition, I'm gonna use your example. How cool would it be to tell my patient, hey, let's put you on a keto diet. I look over the
Yes.
robot, and then the robot's like, okay, here's the keto diet, but then you're gonna like this part. Then you as a patient, you probably have Instacart. And so now my
Oh man.
information, I bridge it to your Instacart. And before you leave seeing me, by the time you're home, you got your groceries that you and I decided that this is the best
Yes.
diet. I mean, that is
That's
true medicine.
And as an insurance company, I would cover that. I would cover your first week of meals post admit, because post surgical readmits I don't get reimbursed for at the hospital, right?
Mhm.
And that's a separate problem in our healthcare system. So I would invest in that. That's what, $150 for a week of food from Instacart delivered to my
Yeah.
door when my patient's stuck in bed, and they're going to get good nutrition that's balanced. Oh, that's so custom. That's beautiful.
Yeah. And so this is how I think we need to leverage. Now, unfortunately, some of my colleagues see things a certain way, and I call it the bell curve. We got some early adopters, we got some middle, and then we got some late ones. And I'm not being age discriminatory or regional of the United States, but depending where you are in the United States and depending on your age to some degree will determine how you see AI. But here's the beauty. It goes back to communication. Hopefully there's someone in your life, someone that can talk to you about AI, explain it really well to you. And then at that point, then those walls come down. Then you're like, okay, I get it. I see the advantages. I see how I can help my patients. But at the beginning, for some individuals, they're really hard on this. Like I've had people tell me, I'm going to quit if AI comes into my hospital. Or some people will be as bold as saying, no, I think AI is the devil. I'm like, whoa, okay, I got some work to do here before I communicate it.
That's really fascinating. You know, I don't want to be negative about the early adopters, the people who are they like doing things the way that they do them today, and they don't want to change them. And so, hearing the idea that someone might say, if AI comes into my hospital, I'm done. Part of me wants to pull them back and go, no, you don't understand. It's so valuable, and you're so good. You realize how much better you'll be. It's a tool on your tool belt. You're building a house, and I'm going to give you a hammer that can put the nails in for you, but you still got to build the house. Like, you're the person who knows how to build the house. And the other part of me says, well, if you don't see the value, then bye-bye, right? Because we have to improve. And it is the people who are going to push back so hard against some of these new tools are probably going to be the first to replace it or be replaced by that tool. Because if I'm not saying AI is going to do a doctor or a nurse's job for him, there's way too much hands-on required, right? Maybe radiology is in trouble a little bit, but aside from that, because of the gray scales and being able to see more shades of gray, but aside from that, really, AI is going to replace people who won't work with AI because the hospital is going to require. It's going to be too valuable. They're going to save too much money. They're going to save too many lives with a doctor who will embrace AI. And so they won't be able to afford to not adopt a better tool to build the house.
I agree. I love how you said it. And I think we're there. And I think I'm going to fast forward a couple of years and say, it's not going to be if you use AI, it's going to be how well you use AI. And then later they're going to say, okay, these individuals use AI better than those, and these are the people we want to keep because they're doing it so well. So in the near future, I'm telling my kids, it's like, hey, listen to your dad. Like, let me help you out here. Let me teach you AI, because in the future, that's just going to be the way it's done. And to your point, Devin, do my kids need all this other stuff? Probably not. They just need to know how to find the solution to the problem, and they need to start learning how to think outside the box, and their creativity plus AI is going to make it happen. And I always do this in my talks. I really strongly believe this other point. It's not that AI is better than us. In my mind, is that the way we should look at it is AI plus human, and in this particular case, we're going to say doctor. So AI plus doctor is better than just AI or just doctor. And that is the way we should do it. It should be both of us together. I'm a human being. As at 2, 3 in the morning when I'm in the ER, I'm not that good. You know, I'm a human being. I'm going to be tired. I'm going to not be at my best. But if I have
Med
a
errors
peripheral
are a thing.
Yeah, exactly. So if I have a peripheral brain, why not use it? Why not just say, hey, AI, here's the differential diagnosis, here's this. And if AI says, oh, did you consider this? You're like, oh my gosh, I totally forgot about X. Let me go back and then double check that. Powerful.
I'm gonna connect this. I know Connor's got a question he wants to ask, so I'll give him toss the mic to him in a second. But I just want to connect this to something. We're actually using AI on our team, on our marketing team, for improving the strength of our team. And so what we do is we have like strength finders, and the strength finders tell us like what my strengths are, what Connor's strengths are, and what Allie's strengths are. And I put those, and I built a little GPT, gave it bumpers in the bowling lane, and I can actually open up that chat and I can query it and say, hey, how do I work with Connor on this project? Or where's my deficits with Connor? Or I have a problem with Connor because fill in the blank. Or Connor's got a problem with Devin, fill in the blank. And they can have a private conversation, right? And you just made me think that with the power of these types of AI tools, that same AI robot with you in that healthcare setting, and you're burning out, and maybe you've made a few verbal errors or some mental deficits in this equation with the patient, and the AI bot privately sends you a text message or a message, or you get some communication that goes, hey, just so you know, you had 3 errors in our discussion with the patient today. Perhaps you need a siesta.
Yeah. Yeah. I love it. Just like the driving. It's like, hey, you're not driving like you normally do. You need to take a coffee break. You know, my car tells me.
Yes,
that.
exactly. Right. Go get some fresh air. Come back. Let's try to, reduce the. We're a team. We didn't give the patient the incorrect information. We corrected each other, but I'm just going to flag this for you.
Yeah. No, I
or
love
maybe
AI.
it's a simple like 98% effectiveness. Today you were 78% effective.
Yeah.
It's interesting.
Take the weekend.
Take the weekend off. Yeah.
That's right.
That's important for team safety. Another thing that we've talked about is like with the integration of like these types of AI tools is can you measure the effectiveness of all the collective staff on the floor? And so the hospital has a metric, and that metric is we're going to call it 1,000 points, right? So all of the members of staff on the floor have a certain amount of training, and that certain amount of training equates to a certain number of points. And so, Harvey, you're super experienced, and so you've got 50 points, right? And I'm a new paramedic, and I've only got 6 points. But collectively, we are just under 60 points on the floor, right? And so the hospital wants to keep an average points on the floor so they know that they can improve their patient success based on training hours. So that's how
Yeah.
they staff the floor, right? Is an average high level of training hours on your floor. What if included in that was an average high level of competency on the floor? And it was like evolving as people were doing their healthcare,
Yeah. I
right?
love it.
That would be really powerful.
I don't know if viewers know this, but Scientific America last year came up with an article and it said the average IQ of ChatGPT was 155. Just to put in perspective, the average human is between 90 and 110. That's something like that. So the fact that it had that kind of IQ, could you imagine having that into your team to the points? And then now we have AI that makes it this low bar, is that the way to say it? Maybe this minimum that's always what's on the floor. We have that plus human, and this is such a
Right.
good standard. Yeah.
How good would you be if you always had a microbiologist over your shoulder
Mhm.
working with you with every patient?
Yeah.
I mean, that'd be so cool. Hospital can't afford that.
Yeah. And then I got to say this because I don't want to forget, but this is another one. You mentioned education, and I love my doctors and my colleagues, but unfortunately, some of my colleagues are not the best bedside manners docs, may not have the best empathy. And so why not use, again, ChatGPT to say, you know what, how can I be better at my empathy? And it'd be like, look, it's the way you're sitting, the way you're talking, the tone, the words you're using. Let's add these into your vocabulary. And all of a sudden I'm like, all right, let me try these tips. And so I think, again, just using that information, and it's going to make me a better doctor, and being humble enough to say, you know what, I'm a human. I don't know everything. Even if I've been doing this for 20 years, maybe I've been doing it 20 years wrong. Let me have some other help, and let me use an expert over my shoulder to help me do better.
Someone who can't admit they're wrong can't grow.
Exactly.
Hey, Connor, have you ever wished that you could test your medical skills in a realistic but low stakes environment?
No, I haven't.
You're not a medical person, but that's okay because it's not a fantasy. It's called VR Patients.
That's right, Devin. VR Patients is a groundbreaking platform that lets you create your own virtual reality simulations. It's like a choose your own adventure book, but for medical scenarios.
And it's not just one kind of scenario. Any simulation you can imagine. You want to create a complex critical care trauma or a simple basic life support patient? You can do it all with VR Patients. And best of all, it's highly scalable, catering to 10 students or 10,000. Connor, did you know that they recently deployed to the entire state of Maine?
I saw an article about that. You really have to check it out for yourself at vrpatients.com. That's vrpatients.com for more information.
And if you're like Connor and you don't know medicine, but you got a VR headset at home, you can try it right now for free on the MetaQuest Store or Steam.
So we've been talking a lot about the positive side of AI, GPT, what have you. What about, we wouldn't be a good podcast if we're not, exploring the other side of the coin. At what point are we getting too reliant on this technology that we're not flexing those cognitive muscles as much and just letting it do it doing the medicine for us? Like,
Yeah.
where's that line? Where do you think that line is?
Yeah, no, I love this topic, actually. I actually think one of the things that I'm very, very worried about is the healthcare professional that over relies on AI because they don't know what they don't know. And so someone early in their career might say, oh, ChatGPT or GPT told me this and it's got to be right, and I'm just going to go with it. When it could be hallucinating, it can be messing up. Or you may be pushing AI into something that it wasn't supposed to be used for, and you're just saying, oh, it told me this, so it's good enough, I'm going with it. And the other part to this is that whole empathy, that whole human touch, it's going out the door if you're not careful. And so one of my biggest worries is I need to make sure that I'm training the youth, the younger docs, the ones coming up the ranks that don't have that clinical gestalt of saying, oh, I've done this for 20 years. To understand, to say, hey, dude, don't over-reliance. Let me give you a quick example. I know I want to say some stuff that maybe some docs out there may not like, but I personally love foreign doctors. And here's why. I would work my foreign doctors and they would do a hell of a great physical exam, and they would really do all these fancy tricks and listen and spend all this time. And when I would read their notes, I'm like, man, you got a hell of a history. Like, this is amazing. Like, you got everything from the patient. And then again, no disrespect to my colleagues, but some of them sometimes are like, oh, we'll just order a CAT scan and that'll tell me, or I'll just do this and I'm done.
Mm-hmm.
And I feel like the art of medicine is being lost. It's a true physical exam, history, and then AI, and put it all as one. And I'm really worried that some young doctors haven't seen that, and they're just going to jump into AI and be like, here we go, done.
I get really excited about what we're talking about right now because to answer Connor's question, I would argue that relieving the physician of exercising some muscles allows them to exercise other muscles. So I don't see it as necessarily a replacement. I see it as, guess what, doc? You don't have to charge as much. You don't have to worry about knowing absolutely everything on page 1562 in your book. You get to put your hands on the patient. You get to actually sit down face to face for 20 full minutes. That's a big deal in America. You're lucky if you get 20 minutes with your doctor, and most of that, they're not looking at you.
Yeah.
They are slammed with charting. And to be able to relieve them of exercising the, what do you want to call it, like clinically robotic piece of, how funny is that? Robots might actually relieve humans of needing to do robotic actions and procedures.
Yeah.
With the exception of surgeons, they get to use robots.
Yeah. No, I love what you just said. You're right. Some hospitals I've worked, the computer that I'm using is not even facing the patient. And so I'm already twisted and my eyes are focused and I'm trying to cram myself looking at them, but I'm typing and it's like so awkward. And
you have to know medical coding.
Yeah. And so what I always say is like, why am I doing this? Why not use AI? And it's been around forever. Why not use this information where we're having a conversation and now all my senses can be on you? Because here's the deal. Unfortunately, patients sometimes are embarrassed about stuff and they lie. They lie sometimes how much they drink. They lie about some of the things that they're embarrassed about. But if I'm not looking at them, I may not pick up on those cues to say, oh, wait, they were lying on this one. And it's not the best information for me.
I got one more question. I'm actually realizing just now that we're running a little bit late, so we're going to pick this up a little.
All right.
Do you have a few more minutes for us?
I'm all here, man. I am here for you guys.
Great. So we're going to we have this little section we like to call the lightning round, and we'll just ask you a couple of questions that you just already know the answer to, like your favorite color and stuff. But I have one more question for you, and of course, Connor, if you've got another one, ping it, but we'll try to wind it down. I want to talk a little bit about equity and access. So we're talking about technology, and you got an Apple Vision Pro in your background, and that's a $3,500 piece of equipment. And AI, ChatGPT Plus, is $20 a month. And if you want, it's $25 a month if you want the one that doesn't train on your data. And those, you have not yet paid for the person, if that's a prompt engineer or what, to keep it operating in the bumpers in the bowling lane. There's a whole new class of workforce. So there's an expensive adoption curve on this. So, Harvey, how do we make sure that it's not only the Harvard Medical Centers of the world that are getting access, that are using this type of technology? How do we start to think about the small rural hospital that are treating patients that also deserve an equal amount of care, an equal quality of care?
I love this. This is awesome. And I talk about this too. I'm worried about the discrimination of this technology because I think as we get better at understanding our disease process, as we're using these tools, work with me for a second, we're going to live longer. We're going to have a better quality of life. But if I can't afford access to these tools, then I am going to die sooner. I'm going to have a worse quality of life compared to someone that does. Quick example, if I grab a cigarette, start smoking in front of everybody, I'd be like, what the hell is this doctor doing? There's stuff going on right now that we don't know, but as AI is teaching us, we're going to change our habits, change what we eat, change things, and we're going to live longer because AI is teaching us. And so how to fix this problem? I joke around and say two things. Number one, we need someone like Elon Musk to donate a good amount of money for better research to fight against the biases and make some equality for us. But I think also it would be nice for some of the hospital systems and bigger corporations to donate these devices to the less fortunate hospitals. So that way there is access and we do our best. But this is like raising a child. It takes a village. It takes all of us coming up with ideas and how can we do. And as a doctor and wanting to give back to the community, that could be another movement. Like, let's make sure that we're taking not care of just the US, but the entire world.
Yeah. I love that. You know, we got some plans over on our end locally out here. I'm in Cincinnati now, and we're working with University of Cincinnati and their nursing school and stuff like that. And I built them a little GPT, and they're beta testing it right now. It's pretty cool. It actually teaches them how to build simulations in virtual reality without needing to know code, so they can create simulations for their nursing students and provide like equitable social determinants of health, like any patient anywhere right there. And so we're working on that with them. But one of the things we talked about with them was like some of the high schools that end up going to that college and becoming healthcare workers, and how to reach back to them and get their feet wet, and how we can do stuff like that. So perhaps maybe we start to consider some like new, like some refurbished Quest 2s, and those types of things to kind of reach back and engage. And can we allow the high school to engage in a little bit of like shared access to the GPT that the college is using, and those students receive the same type of education as they move through their career? So we're working on stuff like that. So if you ever find yourself in a position where you want to collaborate on something like that, you reach out to me, and we'll make some magic for some people.
Well, it sounds like I met my new best friend here, so you and I are going to be hanging out now and talking a lot, geeking out a lot, so I'm glad we met.
Connor, I got to go to Texas. I'm sorry.
Yeah, you have fun down there.
All right. Let's wrap this bad boy up with the lightning round. How's that sound, Connor?
Sounds great to me.
All right, why don't you kick us off? Let's do it.
All right, easy question for you. What's your favorite color?
Blue. Generic blue.
Just generic blue. All right. I'm an orange guy. What about you, Connor?
I'm green.
Green. Interesting. All right, Harvey, if you could have any superpower, what superpower would you have?
Time travel.
Oh, good one.
I love time. I love going back in time and in the future. I'd love to go both ways.
All right. Well, it kind of leads into this. If you could have dinner with any historical figure, who would it be?
Ooh, that's a tough one. I love inventing and entrepreneurship, and I would love to meet Leonardo da Vinci, just to sit down and just pick his brain and like, how'd you come up with this, and what was your thinking, and how's your brain work? Like, how did you do all of this? You know, it'd be just kind of fun to just get that from some, from the classics almost. Different life.
I like that. I never thought about that. I want to sit with Nikolai Tesla now. Just thinking about that. That'd be cool.
Yeah.
All right. What, coffee or tea? You're a doctor. I know the answer. Coffee or tea?
Well, here's the deal. Little background. My parents are Colombian, so coffee. Colombian coffee.
What's your favorite sports team? I know you're in Texas. Are you a Cowboys guy? Are you a Houston?
Now I'm a Dallas Cowboy, so love my Cowboys.
Right on. If you could have any job other than emergency physician, what would it be?
I would love to just be in a think tank and just keep cranking out inventions. I have so
like an
many...
incubator. You want to be a startup incubator or something?
Yeah, I just want to do that all day. Like I tell my business partner that's our goal. Like we need to do well enough so that way we can start all our dreams and just crank out just different dreams that we have.
All right, and last one, I'll tee you up for a home run here. What is your favorite book?
Nice.
Ooh, that one.
You can plug yourself if you want.
That's kind of what I was looking for.
Not to get all religious and stuff, but I really like the Bible in the sense that there's just so many lessons there, and you can read the same thing over and over, and you get a different lesson out of it every single time. And then depending where you are in life, you'll see things differently, and it just seems like a wealth of knowledge that just will never go away. I just love that.
Since we're talking about books, would you like to take this opportunity to tell people where can they find you, some of the stuff that you have that you've built and created, so we can put links in the description.
Yeah. So real quick, it's Harvey Castro MD as in medical doctor, and that's in all the social media, Facebook, LinkedIn, Instagram, YouTube. And then as far as I got to geek out a little bit, I created this thing called the GPT podcast, and all it is I find any blog, I paste it in there, and then within 5 minutes, it gives me my clone voice, it gives me the commercial, my other clone voice of my business partner, and it does the description, it does the AI picture, and then it does the audio file, and then I upload it, and I'm pretty much done with the podcast, which is kind of neat. The other thing is I created this thing called Convo with GPT, and the skinny is I'm uploading different works. For example, William Shakespeare or Sherlock Holmes or all my personal books. And I put them into my own GPT. It's not through OpenAI. It's on my private server. It's secured. And then I can have a conversation with it. It's called RAG technology, which I know Devin knows what that is. And then I'm basically putting information and then having information through it. And it's really cool. And then the last thing we're doing, which will be out next week, is we're creating a smart email. And the skinny is this. Any email that you have, you forward it to this email address that we'll give you. And then it'll create a Excel spreadsheet. And it'll give you all these things like summary points, key points, sentiment of people, like is it a positive, negative? And then we threw in some geeky stuff like a mind knowledge graph and a decision graph and then a draft. And then it all does that from just forwarding an email. So it's kind of cool.
Oh, man, you're going to love Plod. You're going to love Plod. All right, guys, I think that kind of wraps things up. Wait, you didn't plug your book. What's your book that you published?
Yeah, sorry. It's on Amazon.com, and the latest book, it's Apple Vision Pro and Healthcare Pioneers. The skinny is, I just wanted to help my healthcare professionals and think outside the box and literally, how can I use healthcare with this device on? And then I put some futuristic things in. I put it AI plus this, but then things that you could do now. And my whole goal was just to start the conversation.
Okay, our closing question is, if you could give some advice to a new student, a new healthcare student, and you can pick nursing, doctor, whatever, any advice, what would you say to them?
2 things. Stay humble and always learn. Always ask everyone something, because the minute you stop learning, the minute you stop growing. So no matter how high you are in the food chain, you got to keep asking questions and ask 360 evals. Even if you think you're the CEO of some big company, you still need to ask everybody, what am I doing wrong? Because if you don't take that approach, you're not going to grow.
If you can't be wrong, you can't grow. All right, guys. This has been an amazing podcast. I feel like we could easily go for another hour, but we are going to stop here. If you haven't had the opportunity to meet or see Harvey's stuff, please check out Harvey Castro MD or is it Dr. GPT or GPT Doctor?
Let's go with what is it? Doc GPT, I think is what's on the website.
Well, make sure you check him out. Check us out on the YouTube channel, reshare, and we'll see you on the next one. Thank you so much. This has been wonderful. Hey, Connor, are you finding it challenging to organize asynchronous clinical education for all your students?
Devin, I don't have any students.
Well, that's okay, because no matter the class size, from 10 to 10,000 students, we have the perfect solution for you.
VR Patients isn't just a virtual reality platform. It's an asynchronous learning tool, which means students can access it anywhere, anytime.
Exactly. They can jump into a VR simulation from their VR headset or even from their web browser. Clinical competency training doesn't have to be confined to a specific schedule or location anymore.
To learn more about how VR Patients can make learning more accessible and scalable, head over to vrpatients.com. That's vrpatients.com.
And if you don't have any students just like Connor, but you do have a VR headset, you can try it right now for free on the MetaQuest Store or Steam.